Visit licensuraexams.com and try our samples completely free of charge. Hello, and welcome to our Licensure Exams podcast, where we explore a variety of topics related to the world of therapy to help prepare you for your exam. I'm your host, Stacy, and in today's episode, we'll be taking a look at the cognitive elements of the mental status exam, exploring key terms that you need to know about and techniques that can be used to assess your client's cognitive functioning. We'll also talk about how the MSE can aid in the diagnostic process and how your assessment of a client's cognitive functioning can help narrow down a diagnosis. So let's begin by reviewing some basic terminology, starting with attention and concentration. Attention is the ability to focus on specific stimuli. Concentration is the ability to maintain attention over a period of time. Abnormalities with attention and concentration are symptoms of attention deficit hyperactivity disorder, or ADHD, anxiety disorders, bipolar disorders, depressive disorders, and obsessive compulsive disorder. The next term is orientation, and this refers to the awareness of oneself in relation to person, place, and time. You might also ask about a fourth dimension, the client's orientation to their situation. In other words, can they explain why they're talking to you? A low orientation score can indicate substance intoxication or a neurocognitive disorder like delirium, dementia, or a traumatic brain injury. Also, if someone is experiencing active psychosis, they may give strange responses based on delusions they're experiencing. Next up is memory, which is the process of encoding, storing, and retrieving information. On the MSE, memory can be divided into three types: immediate recall, short-term memory, and long-term memory. And memory loss is associated with neurocognitive disorders and long-term alcohol abuse. Language is another term on the MSE, which refers to the ability to comprehend and express thoughts through spoken and written words. Impairments with language abilities are associated with aphasia, schizophrenia, and autism spectrum disorder. If you come across the term executive functioning, this refers to higher order cognitive skills, including planning, decision-making, problem-solving, and impulse control. The list of disorders associated with an impairment in executive functioning is long. Your client could be dealing with a neurocognitive disorder like Alzheimer's disease or traumatic brain injury, ADHD, OCD, depression, bipolar disorder, an anxiety disorder, autism, or even schizophrenia. Perception is another term on the MSE that refers to the ability to interpret sensory information from the environment. And diagnoses associated with altered perception include schizophrenia and other psychotic disorders, neurological impairments, and some substance intoxication. The term judgment is also used on the MSE, and in this context, it means the ability to identify consequences and make decisions that don't put the client or others in harm. So if you note that your client's judgment is impaired, you should be thinking about neurocognitive disorders. For example, poor judgment is a key feature of Alzheimer's disease, substance use disorders, bipolar disorders, and depressive disorders. And the last term that we'll talk about is insight, which refers to the awareness and understanding of one's own condition or illness. A poor or limited level of insight is associated with psychotic disorders, obsessive compulsive disorder, substance use disorders, bipolar disorders, and depressive disorders, and also some personality disorders, particularly the cluster A disorders, which are characterized by a pattern of suspicion or disinterest in other people. Now, when you're conducting a mental status exam, there are several factors to consider. Number one is that cognitive functioning is multifaceted and interconnected with emotional, psychological, and physical health. Number two is that your client's cognitive abilities can be influenced by their environment, cultural background, and situational factors. And number three is that cognitive function can fluctuate due to a variety of factors, including stress, fatigue, medical conditions, and certain medications. And it's really very helpful to establish a baseline of normal cognitive functioning for each client, considering their age, education, and cultural background. If you have that baseline to work from, conducting periodic mental status exams can be a very valuable tool when monitoring the client's progress in therapy. So, how exactly do you go about assessing your client's cognitive functioning with a mental status exam? Okay, so to test their attention and concentration, you can use tasks like a digit span, where you ask the client to repeat a series of numbers forward and backward, like 5, 10, 12, 21, or a simple arithmetic question where you ask them to perform a basic calculation, like what is 7 plus 17? To assess their level of orientation, you can ask the client to state the day, month, year, current location, and personal details like their name and age. To assess memory, provide a list of words for the client to remember and recall after a short delay or after exposing them to a distraction. To evaluate their language and comprehension, engage the client in dialogue, ask them to name common objects, or follow multi-step instructions. Executive functioning can be assessed by using the clock drawing test, where you instruct the client to draw a clock showing a specific time. Judgment can be evaluated by presenting a scenario that involves perhaps a moral or a practical decision that the client has to make. And level of insight can be assessed by discussing the client's thought process and awareness, or lack thereof, of their condition. All right, now let's take a look at a case study. And if you've listened to any of our other podcast episodes, you'll be familiar with our dear client, Clinton. Clinton, a 45-year-old male, presents for therapy due to concerns about his cognitive functioning. He reports difficulties in concentrating, some forgetfulness, and occasional disorientation. Clinton has a history of hypertension and was recently laid off from his job at Publix, which has only increased his stress levels. As you conduct a mental status exam with Clinton, you noted the following. During the digit span test, Clinton struggles with recalling more than 4 digits backwards, which indicates some impaired concentration. Clinton correctly identifies his name and location, but he's confused about the exact date. In immediate recall tests, Clinton can remember 3 out of 5 words, but struggles with delayed recall, managing only 1 word after 5 minutes. Clinton has difficulty naming objects and often uses vague descriptions, suggesting some mild language impairment. On the clock drawing test, Clinton inaccurately places numbers in hands, indicating issues with planning and visual spatial skills. When asked about a hypothetical scenario involving a lost wallet, Clinton provides a seemingly impractical solution and shows some limited awareness of his cognitive deficits. Now, based on the assessment, Clinton's symptoms suggest possible early stage dementia. So if we were to confirm that that's what he has, part of his treatment plan would likely include the use of memory aids like calendars, lists, and electronic reminders, cognitive training, where you would engage Clinton in cognitive exercise that are designed to maximize his cognitive impairment and delay the progression of the cognitive impairment. A routine establishment, where you work with Clinton to develop a structured daily routine in an effort to reduce disorientation and confusion. And incorporating some stress reduction techniques such as mindfulness and relaxation exercises to alleviate anxiety. Well, we've officially reached the end of the trail, so here's a quick recap of what we talked about in this episode. Some of the key terms related to cognition on the mental status exam are attention, concentration, orientation, memory, language, executive functioning, perception, judgment, and insight. Effective methods to assess cognitive functioning include tasks like the digit span test, and you would use that for attention and concentration, word recall tests for memory, object naming for language, and the clock drawing test for executive functioning, just to name a few. Now, it's really important to recognize that cognitive functioning is influenced by a client's environment, their cultural background, situational factors, stress levels, some medical conditions, and certain medications. Establishing a baseline cognitive functioning can really help you when monitoring progress. Until next time, good luck with your studies, and remember, it's in there.